It's a common misconception that chiropractors only treat the spine, but in this video, we're going to talk about the shoulder and how we assess and treat the shoulder here at CCRC. So before we really get into the specifics of this, Dr. Kraft is going to talk a little bit about what the shoulder actually is and what it's comprised of.
Yeah, so normally you ask somebody, their shoulder, it's here, but the shoulder's a weird joint. The only place it connects to the rest of the body via a joint is right here where the collarbone meets the sternum. Otherwise, it's just floating on the rib cage. So we have essentially like the head of the humerus, or the ball on the top of the arm bone, is basically like a golf ball on a tee. It's very unstable, which allows us for lots of range of motion, but also the problem of dislocations or cartilage damage. So when we look at it, we obviously want to consider that golf ball on the tee, the shoulder joint that's wrapped in a shoulder labrum, and there's the rotator cuff that connects to it, that adds some compression and stability and also moves it, but also the shoulder blade, the trunk, the rib cage is what is going to end up stabilizing our shoulder. That's our big anchor that we need to consider when we're looking at that.
Right. Now, when we talk about causes of shoulder pain, I'm going to start by talking about causes of shoulder pain by talking about the neck. Even though I started this video by saying chiropractors treat more than just the spine, I'm going to talk about the neck because I have to, because I'm a chiropractor. 47% of shoulder complaints are actually a referral from the cervical spine or the neck. So with that kind of odds, then we better look at the neck to begin with. And this could be a simple screen of checking range of motion. We could be checking trigger points. We'll check repeated motion. You can watch some of our other videos on the Mckenzie Method to learn more about that. And in the assessment, we may begin to decide, okay, well, maybe the neck is a component of this. So then we may do our treatment focused on that. Now, we can have actual tissue deformation or dysfunction in the shoulder that can cause shoulder pain, obviously. So things like rotator cuff tendinopathy, we have a video on that. You go watch that one. Bicipital tendinopathy, we could have labral issue. We could have trigger points in other areas that may refer to the shoulder. So the picture that I'm painting for you is that shoulder pain is not a one-way street. This is a very multifactorial thing that so many different things can be causing it. So for us to get to the root cause of it, we need to go through the appropriate examination, rule the neck out, check things like strength in the shoulder, range of motion, and then we begin to formulate our plan of action from there. But these shoulder pain cases can be very multifactorial in terms of what may be causing your shoulder pain. So let's talk about the assessment. How do we actually go about this?
Yeah, so if someone walks in and says, "Ow, my shoulder," like Dr. Muse was saying, our first move is to rule out the spine. So we may go through a brief cervical examination to figure out, is that contributing? If we determine that it's not, or that it's part of the problem, maybe not the whole problem, then we can go through an orthopedic examination of the shoulder and figure out, is there compression of some, impingement or compression of some rotator cuff tendons? Is there a labral issue, bicep tendinopathy? And then the big question after that is why. You can have an irritated rotator cuff tendon, but it still doesn't tell us anything, because it's nobody came up and hit you into the shoulder and your rotator cuff tendon swelled. It was something that you were doing. So we will look at, how does your shoulder move? How do you move it? Do you overuse your upper trap and your pec, and you elevate your shoulder blade overhead? So we will go through and figure out, how do you stabilize your shoulder? And a lot of those things we can correct rotator cuff tendinitis by fixing how you move your arm, versus going in and cortisone or something to just deflame the tendon when it was a mechanical problem to begin with.
Right, and I'm going to talk about the treatment, but everything that Dr. Kraft just said, everything that I said prior to that, kind of makes this part easy. If we figure out where the issue is coming from, whether it be the neck or some structures in the shoulder, then that's going to dictate care. This is not a throw everything against the wall and see what sticks kind of thing. We want to be very specific with this. So if we find in the exam that it's actually the neck, then treatment will be focused on the neck using something probably like Mckenzie Method. If it's the shoulder itself, maybe it's a rotator cuff tendinopathy, then we actually need to strengthen and load that tendon. So that may look more like some typical physical therapy exercise you might see, where we're actually just trying to strengthen that musculature. If it's something more like a labrum, then okay, well, same thing. We need to strengthen that joint. We also need to teach the individual how to stabilize and move that joint more efficiently, so that they're not continually getting themselves into the same issue. Now, with these orthopedic things, if there's actually something like a labral tear, a full thickness rotator cuff tear, sometimes those things may need a little bit more work outside of what we do here. But before we even get to that point, before we even talk about things like injections, surgeries, whatever it may be, we need to go through a really good round of conservative care to see if we can change those symptoms. If not, then we can much more confidently refer you out for some of those services. If you have any questions about any sort of shoulder complaint, what to do about it, what kind of things you should be looking out for, comment on the video, reach out to us on Instagram, call us at the office. We're here to help you guys. Be sure to reach out, and we hope you guys have a good rest of your day.